A circular issued in June 1980 from the Oxfordshire Area Health Authority stated that the use of seclusion is at the discretion of the charge nurse or ward sister, and that the length of time that a patient should be put in seclusion should not exceed 30 minutes. We were told by a number of staff that in their experience, this directive often bore little relation to current practice. Our inquiries into the treatment of particular patients was made more difficult by this letter. Signed by the Divisional Nursing Officer of Borocourt Hospital, it states that no one may, under any circumstances, make comments of any kind to press or media. However, in June last year, an experienced member of staff had the courage to tell us about the treatment of this patient, Grantley. Recently, the doctor in charge of Grantley said to our informant, "Look, I think I've made a terrible mistake. Could you go and see Grantley?" The member of staff was horrified by his condition. In her words, he seemed to be on the edge of almost total madness, having spent 6 months in almost continuous solitary confinement. Grantley was then let out of his cell at regular intervals, and his condition improved. However, during the 3 days we were there, Grantley still spent most of his time in his cell. We weren't allowed to see what the patients did in these cells. We could only hear from the outside.
Right, boys, sit down. Sit down. I'm going to let this Where's this clothes? You know, one that they're all dressed and everything. I know. Come on. Yeah. He got them all on. Yes.
One of the most distressing aspects of this type of care, which even the hospital admit is purely custodial, is the effect this work has on nurses, particularly young staff. The gap between their expectations and the reality of ward life can be devastating. Dave Parsons worked with these patients on Laurel's ward as a student nurse for 4 months.
When you've washed and breakfasted everyone in the morning, what can you do with patients that haven't, the many patients left on the wards? You, I don't think, could survive. We haven't got the nurses to supervise them. They would break the ward to pieces. I mean, they're bored, they've got nothing to do. You haven't got enough nurses to cope with them. You've just been through the experience of trying to wash, bathe and feed 20-something severely ill people between 3 of you. Your nerves are already, you know, you've had enough. You've got to relax at that point. I don't see how you could keep going for a 12-hour shift under those conditions. And so the answer has become to use the compounds to open the doors and say, right, go out there and entertain yourselves. But I don't think you're conscious of what you're doing when you're doing that. I mean, obviously, if you work on that ward, you have to do that. You have to, at one point, be the person that pushes someone out the door and says, go play all day, and you have to be the person that callously goes back and has a cup of tea. I mean, how do you do it? That must be something that people ask.
Right, boys, sit down.
I think it's important that when you see the charge nurse taking those patients out of that compound, that I don't think you point the finger of guilt at him. He's been told by society that that is the way society wants to treat his mentally handicapped. It would be absurd to think that you could in any way provide care or some sort of relationship with possibly 2 or 3 nurses on that day. You can't begin. There's no point beginning. It would be pathetic to begin. But you can't explain to people that you've been forced into this situation whereby you're consumed up by despair and you've given up. Maybe the public will say, well, I wouldn't, I'd walk out. But I can assure you that they would stay. They would. So many nurses did stay, and not just, and they are good nurses when they arrive. There's nothing wrong with them. They're not some sort of unfathomable sort of rubbish that the earth throws up specifically to be mentally handicapped nurses. In fact, they're probably some of the best, most caring people around. That's why they responded to those wonderful adverts. you know, they wanted to do a caring profession, but they're in this situation whereby even if they want to get their qualifications and work in hostels and do their job, they've got to get through this. And to get through this, they've got to do today's work. And they've been told to do these things, and you're not doing it to someone, you're doing it. It hurt me to do it, and I think it hurts everyone, but I think with time, you get used to it. I think with time, a soldier gets used to killing people.
As in the majority of mental handicap hospitals, these patients are drugged. Largactil, the main drug used on them, has a number of side effects. One of the most visible is the skin's exceptional sensitivity to sunburn. Their lethargy is as much a result of these drugs as the boredom and isolation of life in the compounds. However, one or two still fight the system. We returned to the hospital 6 weeks after these scenes were filmed and found the compound empty. The hospital were building a concrete base underneath the fence to which they were securing the wire. Apparently, some of the patients have been trying to dig their way out.
You're not doing it to someone that you feel about or you care, or even particularly that you can feel as to be a human being. You're doing it with a sort of inner disgust, but with, well, you've got to do it. There's nothing else you can do. My own feelings by the end of it were just despair. I just didn't believe that this was going on in this country. Sometimes I just, you know, I feel like going out to people and saying, look, don't you realise what really is going on? I mean, it's like some sort of horror show that's going on in the background that no one really wants to admit.
Nurses and patients are caught in a trap, but while the nurses can leave, the patients have nowhere else to go. It's time we examine the behaviour of these mentally handicapped people with a little more honesty, and asked if this disturbed behaviour itself is not compounded by a life in institutions.
It seems to me that the medical profession are particularly keen to see the behaviours as part of the condition mental handicap, and I don't see it this way at all. I'm convinced that these behaviours could be eradicated by good teaching, better staffing, better environments. One could say that you know, the general public would respond very badly, for example, if every time somebody went into a hospital, they deteriorated to the point that you know, that they were unable to come out, in fact. And it is changing these people into objects of ridicule, objects of fear, which it seems to me that the hospitals are responsible for.
As a direct result of his experiences working in mental handicap hospitals, Malcolm Jones persuaded the Spastic Society to open this unit. The only one of its kind in the country, it takes the most disturbed and damaged mentally handicapped children.